Welcome to episode 4 of Drug Free Australia's Injecting Room Scam series. And in this episode, we are looking at the government objective for these facilities of effective referral to treatment. What do governments mean when they use the word treatment? Well, they're thinking of things such as opiate maintenance programs, such as methadone maintenance, a government-subsidised longer-acting opiate than heroin, so addicted users are not needing as much illegal heroin. They're also thinking of residential rehab, which seeks to get them off drugs. And then there is also detox for those that think that they can get off drugs by themselves, or sometimes detox is a condition for entering rehab. How did the injecting rooms fare? Well, Sydney had 11% of its clients referred to an intervention for drug use. 8% were sent for opioid maintenance, 1% for residential rehab, and 4% for detox. And by 2010, the KPMG evaluation showed that there was no change. With astronomical overdose rates, as we saw back in episode 1, where clients are there chiefly for experimentation with more heroin or more toxic cocktails of drugs, getting off drugs is not in their minds, I think we could conclude. By comparison, one of Australia's biggest addiction medicine practices had referral rates of 91% to treatment. Think about that. To give some kind of comparison for these referral rates, we can look at nicotine dependence, where nicotine is as addictive or more addictive than heroin. 70% of smokers say that they want to quit. And from the 2010 evaluation, which we just looked at, they were aware of the criticism of the low referrals. And so they gave some other facts on nicotine dependence. 20% are ready to quit at any time, 37% are quitting, and 42% are contemplating quitting. But this evaluation tried to falsely claim that heroin is more difficult to beat, and so the referral rates were in actual fact disastrously poor. So what was happening in Melbourne? Their 2020 report shows that there were no more clients going to treatment than there were users on the street going to treatment. That takes us to Vancouver. Over there, 18% made it to detox, which is better than the Australian ones, but still way too low. I've spent 17 years in senior management at Mission Australia, one of Australia's largest charities, and another charity called ADRA Australia. And in the first, I oversaw the management of up to 18 large centres and residential units, many with similar staffing levels to the injecting room in Sydney or Melbourne. If I had have seen referral rates like that, I would have closed these services immediately. There's a little bit of an irony in all of this. The most referred to service was methadone maintenance, but we know that methadone maintenance doesn't work. Dr. Richard Maddock was the name of the person who headed up the team that did the first Sydney evaluation back in 2003. This is the same Dr. Maddock who did the Cochrane Collaboration Methadone Review in 2003 and another one in 2009. The Cochrane Collaboration is the gold standard of reviews worldwide, and it found that these programs did well at keeping patients in treatment. Now, if you are giving subsidised alcohol to alcohol addicts, you would expect exactly that. Also found that they used less heroin, like alcoholics drinking less store-bought alcohol. I think you would expect that too. But there was no statistical difference for reduced criminal activity. They were still breaking into homes to fund their habit. Nor did it change death rates significantly. These last two are the very things that methadone is there to stop. Remember that hardly any of the injecting room clients went to rehab. Sweden showed the world what compulsory rehab does. They went from the highest levels of addiction in Europe which is up here, down to the lowest levels in the developed world at that time. Economic recession stopped their spending on rehab, and use went up to these levels here. And at that time, they started to spend on rehab again, and drug use went down. Make your own conclusions as to what is the best referral for an injecting room, and as to whether the injecting rooms are effective with their referrals. In the next episode, we will be looking at reducing the spread of blood-borne viruses.